Good afternoon and welcome to the Care First webinar. This afternoon we're going to look at preparation for coming out of lockdown. Before we get onto the slides, if there's any questions that anyone has, please feel at the end that you can email them to info@care-first.co.uk and we'll respond to all of those questions. My name is Pat Garland-Smith and I'm the Training Manager at Care First, and I'm going to go through this webinar with you this afternoon. So, the government was saying just last week that going back to normal isn't going to be like we knew the old normal. They talked about flicking a switch and going back to the old normal. And I just want to think about that for a minute and remind ourselves of what that looked like. There was the daily commute, often by public transport or road. There were the issues people had to face with parking. There was a face-to-face interaction that we had both at work and at home and with friends and family. There were family gatherings, the outings shopping, whether it be for clothes, retail shopping, or whether it was food shopping. People enjoyed sporting events and, of course, the holidays. All that seems like such a long time ago now, but in reality, it actually isn't. It's only 7-8 weeks ago. But that was what the old normal looked like. Going forward, it's unlikely to look like that again. In the early days, if you remember to perhaps the day when your manager had said that people would be working from home, for those of us that were, there might have been a feeling of anxiety. You sort of felt a little bit out of the loop. We felt uncertain about how this was going to work. How would working at home be different? Would we miss our colleagues? We felt uncertain about what was going to happen next. Some people talked about feeling out of control. Many people felt that they weren't in control of the situation, and also felt that they were not only out of the loop, but didn't have a clear idea of what would be happening. And several people, or many people, talked again about being overwhelmed. It's an overwhelming situation when our normality is removed from us and we're facing a new normality. Then we got into sort of the second stage of this, where we became a little bit more accepting of it. It was like deciding that this perhaps is how it's going to be going forward. We were encouraged to try new things. We were using technology, and before never, I don't think, has technology been so useful. It's enabling us to keep in touch with friends and family. It's enabling us, those of us that are working, to do our jobs. And it's enabling us with children, those of us with children, to help with the homeschooling. So there's so much to be thankful for the technology. And in the early days, that sort of helped us a little bit to understand that we weren't out of touch, people were there. And in that stage, for many, initial anxiety did ease. We felt that we had more control. 8 weeks in, and many are beginning to feel that this is the new normal. We're getting a chance to do things differently and to work differently. It brings up different challenges for people. There's an acceptance. We feel more settled. And many people have talked about feeling safer. We're safer in this bubble. We're not going out. We're here. We know what's going on. And we're less reliant on watching too much news. I think in the early stages, people were having alerts on their telephones. They were looking at social media. We were listening to the news, never ending, and nothing really much changed from one broadcast to the next. But that's what we were focused on, what would be happening. Now, we're sort of less reliant on that, and we catch up when we feel there's something different that we need to catch up on. So with the briefing that we heard yesterday from the Prime Minister. So yesterday, with that government breaching, many are being thrown back into the beginning, where there's anxiety again. It's worth remembering that things won't return to norm as we knew it, but time will be taken to get things in place. Safe guidelines will be followed, and employers will all be taking appropriate advice. No one is going to be thrown back into a place where your employer doesn't feel that it's safe to be. The health and safety response to all this is to look at aspects of corporate health and safety in terms of not just physical health and safety, but mental well-being as well. And they're looking at this 4-stage response, which is prepare, inform, prevent, and recover. And their diagram for it looks like this. We've got 1, prepare. And that's get ready to return to work and identify some sort of work plan. Obviously, that would be done with managers and senior planners within your organisation. The second part of that is to inform. People feel happier when they know what's going on. So there will be to establish a return to work programme and establish who will communicate with staff. The more senior the person that makes the communication, the better it is in this instance. Then there's stage 3, which is the prevent. And for this, they ensure that all health and safety is managed and maintained appropriately. So that might mean, or it will mean extra cleaning. It will mean sanitizing lotion in the office. It will mean that the floors are marked out to ensure social distance. It will mean that desks will be moved. The workplace will not look the same when we return. And this is all about the prevention to make sure that people stay well and healthy once the lockdown is lifted and we are back at work. And stage 4 is the recover. And this is the business recovery, and it's a key stage. Leaders are going to monitor the effectiveness of the return to work programme to ensure that it remains effective and supporting those people who have returned to work. So be reassured that it's not just going into your office tomorrow without all of this work going on. And maybe as an employee, you may not know all of the stuff that's going on, but your managers will. And part of that is to inform you so that people feel happier in their return to work. So let's have a look at our mental health and well-being, because this is really important at the moment, and it might be worth asking yourself how you manage change. We've undergone one of the biggest changes that most of us will ever have experienced, and hopefully we'll never experience anything like this again. We've adapted reasonably well to this. Some people have adapted very well to this. We have to recognise how things are for us in terms of our comfort level. Do we feel safe with this? Do we feel safe within ourselves? What are we comfortable doing? Before we step back into this new and different world, we need to ask ourselves some questions. How can I do things differently? Do I want to go back to the way things were? What, if anything, have I learned from this period of lockdown, this time away from the world? I know, talking to clients and customers, many have said, we've learned so much about ourselves during this time. We've learned that we can cope without as much as we had before. We've learned that we can cope with shopping on a minimal way. We've learned that we can communicate in different ways. So I think for everyone it will be different. There's no right and wrong. So ask yourself those questions again. What can you do differently? Do you want to go back to how things were? And what, if anything, have you learned from this period away from the world? If you want to change anything going forward, how might you do that? And who can you talk with about those things? Is your manager approachable? And would they understand if you had, perhaps you were struggling with your mental health and you were experiencing some form of anxiety or depression? Would you feel comfortable talking to your manager? And would your manager be approachable and understanding to your situation? And also, do you need information to help reach any decisions? If so, what sort of information? And finally, it's about asking yourself, where can I obtain reliable information? Probably not from social media, but inform yourself where that reliable information can be found. So in terms of self-care, it's about learning to look after yourself, not just now, but going forward. And remembering what you need to look after your own mental health and well-being, your physical well-being. Remember your appropriate diet, your hydration, not too much alcohol. Remember you can exercise. You can exercise more now as well. Try and do something for yourself that you enjoy, that's appropriate to right now and within the regulations that we've been told about, and something that makes you feel good too. Helping someone, communicating with someone, being kind to someone, all helps in terms of our self-care because it makes us feel good as well. Remember, the world is changing, and for many this will be a scary time, but for others they see it as a time of opportunity. Whatever the longer term outcome, we need to be aware of our own needs. So we have to be thinking of our comfort levels. How comfortable do we feel? Our own safety, as well as that as our family. What will it mean going for a walk in the park? How many other people will be there? How safe do we feel with that? What about our ability to stay well? How good are we at that? We've been locked down now for 8 weeks, so many of us have learned strategies to cope with that. And also our level of resilience. How will that be when we go back? If we think about resilience now, it's broken down into several areas. The first one being around resilience, we look at purposefulness. What is our purpose right now? And what will that be like when we return to work? We look at adaptability. It's really important in order to aid resilience to be adaptable. Well, most people, thankfully, have been very adaptable during this last 8 weeks, but we need to keep that up. And remember, when we go back to work, we have to maintain that level of being able to adapt to the new situation. In terms of confidence, I would imagine going back to work right now, some people might not feel confident with that because of all the things we've already discussed. So think, what do you need to build your confidence level? We probably feel confident within our own household. It's a safe bubble. We're here. We know what's expected of us. But remember, in terms of our resilience, it's important to build our confidence back up. And also social support. Now, social support has been really different. It's been difficult for some people. For others, they've had other ways of communication. They've been Skyping their grandchildren, they've been Skyping family and friends. But social support is so important in terms of maintaining our mental well-being. People that live in social isolation are more likely to have a better quality of mental health and welfare. It really is about saying our level of resilience need to be maintained. So we're looking at purposefulness, the ability to adapt, to be confident in what we do, and to grow and maintain our social support. And remember that Care First is there 24/7 for contact. It's available for telephone counselling and support, contracted counselling over the telephone, information services, management support and advice, and critical incident support. We're there in exactly the same way as we were before. The only difference is right now, we don't offer the face-to-face option of telephone counselling. I haven't put a number up there to reach because each organisation will have a different number. But if you want to speak to us at Care First in confidence, please look up your own 0800 number and give us a call. The information specialists are there and are excellent in terms of giving advice and information. And they've been extremely busy during lockdown with people asking all sorts of questions. So remember, it's not just about counselling, but also information and advice. You can also get help and support from your Care First lifestyle site, which will give practical information, support and advice. You can also log on to your Care First Zest site, and that will give you the practical steps for health, physical health and well-being. Thank you for your time today, and do remember, any questions to info@care-first.co.uk. Thank you.